if you will please join me in the Pledge of Allegiance. I pledge allegiance to the flag
of the United States of America
and
to the republic for which it stands, one nation, under God, indivisible, with liberty and justice.
Thank you. I'd like to welcome everybody here this morning. Teresa, if you would call the roll.
Commissioner Hoffmeister,
Here.
Commissioner Houts, Commissioner Leininger,
Here.
Commissioner Collins,
Here.
Commissioner Schaefer,
Here.
Commissioner Stoll.
We have 4 members present. That is sufficient for a quorum to conduct business. We will continue on. Item 1C is approval of the agenda. Do I have a motion to approve the agenda as presented?
I make a motion to approve the agenda as presented.
Second. I have a motion from Commissioner Hoffmeister and support from Commissioner Schaefer to approve the agenda as presented. Any discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Approval of the minutes from the February 26th, 2026 Board of Health meeting.
I make a motion we approve the minutes from February 26th, 26.
Support. I have a motion from Commissioner Hoffmeister, support from Commissioner Collins to approve the minutes of the February 26th Board of Health meeting. Any discussion on those minutes? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Well, next up on our agenda, item 2 is public comment. We do limit the public comment to 3 minutes, both your time now and at the end of our meeting. So if we have any public comment this morning? Okay. Item 3, Dane Porter from Manicasterian. Good morning, Dane.
Morning, how are you?
Good, how are you?
So my name is Dane Porter. I'm a senior manager with Manicasterian. We recently completed the audit for the health department and wanted to attend today and present the results of the audit to you. Go over any questions you guys might have. Some of the things we consider to be some of the key financial highlights, I guess. And like I said, to answer any questions you guys might have. Feel free to stop me at any time as I go through the presentation if you want to. If your question comes up, if I can't answer it today, I'll get back with you as soon as I have a chance to look at our work papers, and I'll get back with you with a good answer. So first off, I want to thank the staff, Teresa, Jennifer, for their assistance during the audit. Everything went smooth as it has the past several years, so we definitely appreciate that. You should have each received a copy of the bound financial statements prior to the meeting, I believe, and a letter to the board. Then before the meeting, I passed out the little presentation packet that I'll plan to follow along with. Everything that I plan to touch on should be in the presentation packet. So we don't flip around in the full financial statements to find the page I'm looking at. So with that, we'll turn to the first page of the presentation. It's a few select sections or paragraphs out of the independent auditor report. It's the one piece of the financial statements that we consider to be ours. We test your balances. We put it together as the bound financial statements, but it's still your financial statements. We're just giving our opinion on them based on the audit. I always like to remind you guys that the objective of the audit isn't necessarily designed or intended to detect fraud. Certainly, if we were made aware of anything during the audit that we were concerned with, we would share that with you. So one of the first sections in the independent auditor's report is the opinion paragraph. So we've issued a unmodified opinion. It's the highest level of assurance that we can give based on the audit, I guess. There are 4 different opinions that are available to us. There's the unmodified. There's no modifications to it, no qualifications. Basically, just the financial statements are fairly presented in accordance with GAAP. There's a modified opinion that's available. If you guys are omitting something that's required by GAAP, such as capital assets, long-term debt, leases, something like that, we might say, except for the effect of capital assets, financial statements were fairly presented, or except for the effect of long-term debt, something like that. There's also an adverse opinion, so if the financial statements were not fairly presented, we'd simply say that. And then the last opinion that's available to us would be to disclaim the opinion altogether, say we couldn't complete the audit and we issue no opinion. So obviously the state and the granting source, and they're looking for that unmodified clean opinion. As far as management's responsibilities for the financial statements, management, being the board, administration, is responsible for the preparation and fair implementation of financial statements, according to GAAP. That's gonna include the design, the implementation, and the maintenance of those, internal controls over the financial reporting. And you're also, as I mentioned before, you're responsible for fraud detection, fraud deterrence, and fraud prevention. And finally, the auditor's responsibility for the financial statements is to obtain reasonable assurance, not absolute assurance. We can't test everything. But we'll test the significant balances and provide reasonable assurance that the financial statements are free from material misstatement. So with that, we'll go to the next page. It's going to be the first of, there are two sets of financial statements in the financial statements. There's the government-wide statements, pages 10 and 11. So the statement of net position, the statement of activities is more of a government-wide, long-term, full accrual focus. The statement of net position here, this is a snapshot of your financial condition, the close of business on 9/30/2025. A couple of key factors we like to point out here would be the current ratio, the liquidity, how easily pay your bills when they come due, kind of thing. Looking at the current assets, 4.9, almost $5 million in current assets, versus about 1.3 million of current liabilities. So you've got about 3.7 times more current assets than current liabilities. Easily able to pay your bills when they come due. Very liquid, very fluid. As a benchmark, anything over 1 would be a good number. 2 will be a little bit better to strive for the cushion, but definitely 3 is a nice healthy place to be. The only thing's not really circled on the page here, but I usually like to point out, because it is a large number on the balance sheet, on the statement of position here. The deferred outflows and resources, about halfway down the page there, the 1,187,331. That's going to be items that have already been incurred, but they're going to be expensed in future years with the pension. So it's going to be the contributions from like January 1st until the end of the year, because MERS fiscal year ends on December 31. So anything you guys paid into MERS January through September is not reflected in the balances of MERS yet. So is that $1.1 million that's considered to be an asset. And then the liability for the net pension liability itself is at about $2 million. Those two things net to be about $812,000 net liability. That compares to about $1 million a year before. So you've improved your net position in that pension liability or the pension items by about $200,000 during the year. Last thing to point out on this page would be the unrestricted net position there, the 2,687,000 at the bottom, positive net position. Next page, statement of activities. This is going to be the government-wide statements again, the results of operations for the fiscal year. Left-hand column for the expenses kind of shows the cost of the various programs that you guys provide. As you go to the right, the charge for services, operating grants and contributions show any direct revenues, so charge for services or direct grants specific for those programs. Right-hand column shows the net cost, I guess, of the provided services, whether they're self-sufficient or if they're supported by general revenues such as your county appropriations, miscellaneous revenue, interest, things like that. Not uncommon for numbers to be negative in that column. Usually the programs themselves aren't fully supported by the charges that you receive, and then also the grants. So a lot of that's going to be supplemented by the county appropriations and the miscellaneous revenues. Bottom line here is you added to your net position $685,459 for the year. Next page is going to be the first, I guess the only one of the fund level financial statements. So the balance sheet. Again, this is going to be more of a snapshot of your financial condition 9/30/2025 on a modified accrual or more of a short-term focus. Current resources, the pension liability, capital assets, things like that won't appear on this page, but those are all long-term items. Biggest thing to point out here on this page is we always like to look at what we consider to be the unrestricted fund balance. So the assigned fund balance and the unassigned. There's 5 categories of fund balance. There's non-spendable, things that you've already spent, such as inventory, prepaids. Can't really spend it again. You're just going to use it in future years. There's restricted fund balance, which would be outside granting sources. Committed fund balance would be board, more formal board action, board resolutions. Assigned fund balance, more of an informal management earmarking. And then the unassigned would be everything that's left over. So what we consider to be the unrestricted fund balance would be the assigned plus the unassigned, which combined to be about $3,821,000. That compares to your annual expenditures of about $8.7 million, or 44% of annual expenses in fund balance. GFOA always likes to recommend between 17 to 25%. Give yourselves about a 2 or 3 month cash flow. So definitely 44% is a little bit above that number. A nice healthy fund balance. Not excessive depending on future plans, future spending, but nice healthy fund balance there.
Didn't say that again, it was 17 to between 17 and what?
17 and 25.
And 25%, okay, thank you.
Next page, statement of revenues, expenditures, page of the fund balance. Again, the fund level financial statements, modified accrual, short-term focus, the results of operations for the fiscal year. In terms of total revenues, revenue for 2025 were about $9 million, just over 9 million. That's an increase of about 672,000, or about 8% over your 2024 numbers. Biggest change I saw there was federal and state grants increased about 937,000. In terms of total expenditures, about $8.7 million. That's an increase of about 22,000 over the year before, so a little bit less than 1%. That's very consistent in terms of total expenditures. And then the bottom line is you added to your fund balance 368,000. You did use about 281,000 in the year before, so and you added to your fund balance for 2025. And I believe your amended budget was projecting a balanced budget, so no change in fund balance essentially. Next page, this little bar chart showing for the general fund, total revenue, total expenditures, and total fund balance over the past 5 years. Blue bars being the total revenues, burgundy bars being the total expenditures, and the yellow bar being your total fund balance. Biggest takeaway here would be that we've added to your fund balance in 4 of the past 5 years. So like I said, back in 2024 last year, we used a little bit of the fund balance there. So nice healthy upward trends. Next page is going to be a pie chart, or a couple of pie charts rather. Looking at your revenues and your expenditures, showing the composition of your general fund, where the money's coming from, where it's going. Largest revenue source being the intergovernmental grants. So things you're getting from the state, federal government, many local grants. That's at about 79% for the current year, 75% the year before, so pretty consistent. Next largest would be your charges for services at about 7%, pretty about 7% the year before. And the next largest would be, that's the county appropriations at about 8%. That was about reading the stripes, 7% the year before, 12% the year before. Then the next pie chart there is the same thing for expenditures. So your largest expenditure source would be salaries and wages, 41%. And those also 41% the year before, so almost identical in terms of a percentage. Next largest would be your fringe benefits at about 21%. That was about 23% the year before. And then I believe the third largest would be professional services at about 13%. That was also 13% the year before. So almost identical percentages with the expenditures. Next page they've got is the schedule of finance question funds. So because you did expend more than $1 million in federal and works, you're required to have a single audit or a uniform guidance audit, which is testing your compliance with the major federal program. So it's set up in essentially 2 different sections to basically just summarize the audit. The first section there, financial statements. Again, we issued a unmodified opinion on the financial statements themselves. There were no material weaknesses, no significant deficiencies, and no non-compliance material to the financial statements that was required to be reported. Also, for the federal awards, There was also no material weaknesses, no significant deficiencies, and we issued a unmodified opinion on your compliance with the grant requirements. No other findings required to be reported. As far as our testing goes, we tested the WIC program, so the supplemental nutrition for women, infants, and children. That gave us about a 31% coverage of your total federal awards. And then this last section there, auditee qualified as a low risk auditee. That's a yes, because you had a single audit in each of the past 2 years with no significant material findings. So we're able to consider you to be a low risk auditee, which simply means that we can test 20% of your federal awards, those 40%. So if you were a high risk auditee, we would have had to have tested a second major program to give us the 40% coverage instead of the 30% that we got with the WIC program. Then lastly, coming up in the future, we've got coming up next year, we've got 2 new auditing standards coming up. ASB 103, expect next year is the financial reporting model. You'll see some minor changes probably in the MD&A, and then also in the budget to actual statement. You're going to be required to show. Currently, we show the original budget, the amended budget, the actual results, and then the variance for the amended budget and the actual results. But next year we'll have to show the original budget, the final budget, and then a variance column between the original and the final budget to kind of show how accurately or how well you set the original budget, I guess, and then you'd be required to explain significant budget amendments during the year. Next thing would be GASB 104 to expect next year, capital assets. Really no significant change coming up on that one, I don't think. Basically just just requires in the capital asset and in the long-term debt notes to distinguish between tangible assets and then intangibles such as the leases, subscriptions, things like that. So I believe we already show those in the notes as being intangible right to use assets. And then the last one would be coming up in 2027. GASB 105, which just talks about disclosures for subsequent events. So probably not really much of an effect there, unless there's a significant event after the year ended before the audit gets issued that needs to be disclosed. So that's all I plan to go over. If you guys have any questions, I'd be happy to try to address them here.
Any questions for Dane?
Mr. Chair. Thank you for doing this report, Dane. This looks great, and thank you for the staff for helping out. Obviously, getting all this. I mean, this is very well organized. I always have a lot of faith in Teresa and kind of what we're doing from the finance department at the Board of Health. I like the reports, Dane, that you guys do. They're probably the best that I see on all the committees that I'm a part of.
Good.
One thing I would, and this is just an added, if I like it as a board member, I always like, because we do oversee different agencies and that type of thing. It is kind of nice to see what the benchmark is. I appreciate you telling us what the benchmark is. If you could somehow, when you highlight some of these things, if you could give us kind of like a benchmark on paper, like, hey, this is usually what the industry is, or this is what the standard is, that would just help me out. Just advice. You know, again, you guys do a great job, so that's not a criticism whatsoever. I appreciate it.
Good.
Looking at our current ratio, looking at our, our unrestricted fund balance at 44% versus kind of the standard of 17 to 25%, this is just a general comment for Teresa and Rebecca. And knowing that we do have kind of this $800,000 pension liability kind of hanging out there. I know we're going to talk to MERS in the future. We have $4.2 million in cash, which I know that's not all unrestricted, but I'm wondering if we should still continue to put together a strategy of knocking that down. We are above the standard in our unrestricted fund, which is a testament to the agency and frugalness, which is phenomenal. If we can pay off some of these future liabilities, I think it might be a smart idea. That's just one board member. Obviously there's trade-offs there, but I think it would be smart, maybe prudent on our part. So, but I appreciate the report. And it looks like, well, again, it feels like we're doing a good job.
I guess in discussing that fund balance and that fund balance percentage, Dan, I know many different accounting firms look at different things. yeah, some will judge fund balance based on percentage of revenue as opposed, and you guys are judging it as a percentage of expenditure. I know state legislature likes to look at fund balance as percentage of revenue, not percentage of expenditure. So there are different ways to look at that, Jared. I know in Hillsville County, and I haven't looked at St. Joe or even Branch County's audits. I don't know where you guys are sitting at on your county general fund balance. Our fund balance is nowhere near even 10% really. So, but I do believe that a good share, even at 44%, a lot of that is designated, and we can't just use it to pay down on that pension fund. So, but yeah.
We are looking.
And that's at staff's discretion. From my perspective, you all know your day-to-day capabilities. I would never put anything on you to do that.
And my only comment is, I would have much rather seen us take that 200 and some thousand that we saw the increase in the fund balance this last year and pop that into that's a down payment on some of that unfunded pension obligation that we still but understanding that some of that is final numbers that you don't have until we get this report back. So
Exactly. Sometimes the timing is tough.
Yeah.
I don't want to overspend because then you guys will get after me.
any more questions for Dane? Hearing none, I will at this time entertain a motion to accept the audit and have it placed on file and published to the agency's website.
So moved. Second.
A motion from Commissioner Hoffmaster, support from Commissioner Collins to approve the agency's audit and accept it, have it placed on file, and I'm gonna guess staff maybe already has it on the agency website, maybe not.
It's in the board packet, but not published in the normal spot.
Any discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. That brings us to item 4, health officer report.
Morning.
Good morning.
Good morning.
Well, we flew right through the audit, so we're on to my update with regards to accreditation. We did have the accreditors in the first week of March 2nd. This was the 9th cycle of Michigan accreditation of local health departments. Our agency goes second, and we always have gone second. We were one of the pilot organizations with regards to accreditation in Michigan. And so we get to lead. It's kind of a nice place to be. Out of all of the programs that are accredited, so the ones that are accredited are essential local public health services programs. So you would commonly remember those as food, wells, not wells, on-site wastewater, communicable disease, immunizations, hearing and vision. I'm missing something. But anyway, all of those programs that were reviewed and all of the indicators that are reviewed to ensure that we're meeting minimums. After all of that was done, we had almost entirely met. In other words, everything was in compliance. There were just a few that were noted as not met. Those were in on-site wastewater and in immunizations. Both had 2 each in each program. And then we had one indicator that was a met with conditions, and that was in immunizations and in food, right? So it went very, very well. The agency has had a large turnover in management since the last time we went through a traditional accreditation, which was not this last cycle. Cycle 8 was essentially a handshake and conversation because we were just exiting the pandemic. So it was not what I would call a regular review. It was not a regular review at all. So cycle 7 was quite a long time ago, and we had many different management here at that time. So I'm very proud of the management team that we have today and their understanding of what needs to be done, the minimum program requirements that they need to meet, and how they've managed to lead their staff, which again is mostly new, into compliance. So overall, it went very well. Anything that did receive a not met, any indicator that received a not met, the directors will be putting together with their staff a corrective plan of action. And then they pass that along to the program staff at the state for their approval. And then they implement that, remeasure, and share that information with the state as well. And then after we've gone through that series of actions, and they agree that now we are meeting the minimum in regards to that indicator, they will then push our accreditation through to the accreditation board so that we can be recognized as accredited. So we do just have those 4 indicators that need to go through that process. And then we'll be seeing Laura De La Rambellier back here presenting our accreditation certificate.
Can you highlight anything more as to what those issues were that caused it to be?
I'm gonna I will let Heidi and Joe take turns on what those were.
For immunizations, one of them was just, you have to download the data letter for your temperature monitoring every day, and that a couple days were missed. And the other one was just like an all or nothing. Do any borrowing between private vaccine and BFC at all? So not met.
You said borrowing?
Borrowing. So if someone came in for a vaccine and we didn't have it in one stock, we can use it from another, but that is a deed.
So we have it in stock, but it was brought in stock for certain class of clientele.
Yeah. Just stuff like that.
For food,
All or nothing.
Yeah.
Yeah.
food, it was, we were not doing, tracking the trend analysis for foodborne illnesses. And luckily, and I can't believe I'm saying so loud, we don't get a lot.
We weren't tracking trend analysis, so a flatline trend, you're not tracking.
We were not tracking the trend analysis in a way that we could show them. And it was a simple box on a form. We were using a very old form that has been corrected already. For on-site, it was measuring locations of borings. In some instances, we were using GPS coordinates, and we don't have approval from the state of Michigan to use a GPS coordinate location for boring. And then the other one, remind me.
The other indicator is very broad.
Yeah.
So there's FDR that covers quite a bit, requiring 80% of all elements be contributed. When we switch to our new data software, Hedgehog, the ways in which we track the permit documentation has limited elements compared to our old form, and that is in progress. So it was a variety of different individual ticks that added up all together, and the review contributed to it.
But something that we have a handle on.
Yes, absolutely. All being fixed currently are already.
So if any of you don't know Kyle Moore is our environmental health supervisor. And he supervises our on-site wastewater and our drinking water programs. So
So you're using, a boring, so you go out and do a bore on a site evaluation.
Correct.
There's no address.
No.
Well, a lot of times there may not even be an address yet.
Yeah.
Because you're doing a site evaluation. So how does the state want you to track where that is?
Well,
That's the,
I'll let you know. They want two measurements from two fixed locations. Something that isn't going to move. Potentially.
it's a 2-point measurement
Yeah.
from a fixed location.
Yeah.
It could be a power pole.
those get
So-
moved all the time, so, and
Yeah.
trees get cut
Only during
down,
tornadoes.
and rocks get moved.
Well, I wouldn't, I don't know that I'd use a rock.
You'd be surprised if you go back and you read some legal description.
Yeah.
That is true. Yep, that was some of our comments that we had to them, but we're working on a process to get that taken care of, and we'll maybe even applying for the ability to use the GPS location, so that way we can stand there with our phone and go.
I would assume that's where it's going, right?
That would
It
make
seems like
way
that's
more
where-
sense.
Yeah, I think that's the case, and I'm not sure the state's reasoning on why you have to ask for approval for that, but
Because even, I mean, even well drillers, when they drill a well,
Mhm.
they use,
GPS location.
GPS isn't gonna change.
geocoding, not going away. Oh,
Well, and it's much more,
Anything could change.
yeah,
Within inches.
yeah, it used to be, you guys remember, it used to be, you were several feet off, right? But the technology has opened up and now it's pretty close, so. But-
Okay.
So that's what it was. Still very proud of the team. Can I move on? Okay. All right, when we do receive all of the reports, I'll make sure that you have them. So probably the next board meeting, you'll have a thicker packet because it contains all the reports from the state program people. Yeah, more paper, right? We do have, on the agenda today, the website redesign bid proposal that the finance committee reviewed. There were two, and they have selected one to bring forward today for your action. So we look forward to moving that project forward. Employee recognition, we do want to recognize those staff that have completed milestones in service. And so that's part of the agenda today. The community health improvement and strategic plan is continuing to move forward. Just wanted to let you know, we have not forgotten about that project with everything else that's going on. Staffing update, we do have a couple of positions that are still open. One of those is for an environmental health sanitarian in St. Joseph County. We are seeing another retirement. One of our staff members that's been with us for a very long time, longer than me, is getting ready to retire. And so we wish him well on his next adventure, whatever that might be. And that his name is Lee Sullivan. And then I think actually you might be all set now, Laura.
Yes.
She's got an offer. And I'm not sure where we sit with the immunization clerk, if we're still looking in St. Joe County, but we are still.
Yep.
Okay. The mobile unit continues to offer services in Waldron and Litchfield. Been talking about whether or not we should bring that over to Three Rivers, and we're still talking. So
let's say, with the names of the building, is that a possibility that you could park it even right there at the facility? And
I think we can.
the concern though is once construction starts.
Right, exactly. And, the only bathrooms available would be inside. So, so that's what is causing a pause, right? Unless we brought in nobody wants a fridge up. Doesn't seem like the right thing to do in an outdoor setting. So,
There are fancy ones out there nowadays.
there
that
are,
Oh, yes.
There-
They are,
It's like saying fancy sushi guessing.
Jared, I keep, so,
You'll have to have running water.
No,
It's
no, no.
quick.
well,
Yes.
sorry.
They have those?
Oh, yeah, you just, I mean, so, our daughter's wedding, we rented a 3-unit on trailer.
Yeah.
110 volt AC and lights and run a hose, run a cord. Yeah, all self-contained. Really?
They have one at Union City's baseball field.
Yeah.
Over
Yeah.
there, the got
They
air
are-
conditioning.
I mean-
you took a hose up,
Air conditioned, heated, yeah.
Burroughs septic tank cleaners, if they have it. and
Might
they go
be-
and Pump it out.
might be cheaper than renting space. So thank you. We will look in. Maybe that's the way to go. We have a mobile unit and we should use it,
Yeah.
right? So. Okay, all right, tornadoes. So I believe you all have a copy of this report. It is from the structural engineer. It has YA at the top of the plan. So this is the report from the structural engineer. Lots of photos in there. You'll see that it could have been a lot worse with regards to the amount of damage that our building did receive it. And obviously we feel it was awful. But it wasn't enough that it is going to require a complete rebuild. So, the structural engineer is calling for a portion of the building to be rebuilt. That roof and obviously some of the internal structure, but he's not calling for the entire roof to be done, other than that it needs to be resided, right? And he's certainly not calling for the building to be raised to the ground and rebuilt. So, we had a meeting, Teresa and I had a meeting with our insurance company. I don't know what to call her. She's not the adjuster. The adjuster is Zach Reitz from, what's that company called? Sedgwick. So they contract the adjuster out. Anyway, we met with her and Zach and had a discussion with regards to this report. Zach was tasked with getting a hold of Van Dam and Cruisinga and letting them know that we wanted to expedite this process as quickly as we can with regards to getting a roof structure on so that we could start utilizing a portion of the building that wasn't damaged. I later that day or the next day, I don't recall, had a phone conversation with the gentleman who's been doing mitigation, the project manager for that. And it was obvious that he had spoken with Zach and had received that instruction from them. So he was actually on his way down with the gentleman who's going to be the project manager for the rebuild of the roof structure and the work that needs to be done. And the reason for that was to start working on putting together a bid so that they can start having conversations with MMRMA about cost and rebuilding and everything that goes along with that. So any questions about the building at this point?
So we're gonna have to re-roof it, and I
Yes.
don't know what MMR may think to consider, or what they're going to pay for to re-roof the area that was damaged, or pay to re-roof the whole thing.
I think they're gonna have to pay to re-roof the whole thing. There's shingle damage all the way down.
Okay.
And
And so,
I think if the shingles don't match,
well, that's
they
not
gotta
necessarily a requirement on insurance coverage at one. No.
change. Okay.
That changed.
Okay.
Yeah. We don't, insurance no longer pays just so it looks the same all the way across. But I'm going to suggest that we highly consider taking that money for the roof that they're gonna pay, and us potentially looking at some upgrading to that and spending some of,
Sorry.
Metal roof.
Oh, metal.
I've actually verbalized the same thing in-house.
and whether that be, we can go really crazy and go with the stamped steel shingle looking metal roof that the last I knew was $55 to $60 a square. It looks like shingles when you stand back and look at it, and it lasts a long time. Or we look at some standing seam metal, what I'm at too,
I noticed in Centerville a couple of years ago when the tornado went through there, there's a lot of metal roofs that got rebuilt.
I would say a lot of those are that are metal roofs, but they're really pole barn steel metal roof. They're not both of those options that I just mentioned, whether it be the standing seam or the stamped shingle, is much higher grade, much higher quality than it may be something that we may need to talk to St. Joseph County about doing something like that, because that is their building. To make sure that they would be okay with us changing that roof material from shingles to metal.
The standing seems so much better because there's no nails,
Well,
no
but
screws, no nails, nothing. It's all,
well, there,
everything's hidden.
right. Even though metal and they're coming panel, about the same width as the shingle, and 2 or 3 shingles high. There are still, everything there is hidden as well, so the next panel locked in over top of it, so.
This would be for longevity purposes.
Shingles ought to be out.
We were close to the depreciation on the roof in Three Rivers anyway. We were what, 3 years out?
At 29.
So
How old was that roof was done when?
It was done in 2009.
so
Yeah, I would defer to staff.
I'm
I will-
before putting a roof. that
I will
lasts
say-
10 years.
Your phone won't work as well inside when you put a metal roof on,
Well. I mean, like this one,
unless it's pulling off the Wi-Fi,
right?
but yeah.
Maybe that's a good thing.
So again, just to reiterate though,
Mhm.
the plan would be to redo the roof first so that we can at least use half of that or the lightly damaged part of the building through that.
Right.
And then work on the other part while we're still conducting business on at least part of it.
Well, we've got a bunch of windows replaced even in that other end as well.
Yeah, and the front door. So, even getting into the clean end, the front door and the window next to it were destroyed. So, I don't remember if any of the lobby windows were going. Do you? It doesn't
They
matter.
were boarded
So
up.
there are some.
Single, just a single pane at the double pane.
Yeah,
The only ones that were totally penetrated were in the
back
vestibule and the front door, and then back in the corner were Dale.
Mhm.
So Dale, Amy,
So-
Katie.
Was that an employee's car that had all the damage in the parking lot?
And hers wasn't the only one. Hers was just the only one maybe still there.
Yeah, it
When
was
he came?
still there.
I know
Most- Yeah.
it's premature, but so what do we think ETA on at least getting staff back in there, as they say?
Yeah, so initially they were hoping for 4 months or so, but the conversation that Zach had with Van Dam was, we want you to get on this, we want it to be faster.
Yeah.
But, it is what it is.
Well, I'd figure, right, even if you get the trusses rebuilt and get that speeded and start on the roof. Yeah, you're probably looking at 4 months even just for that.
So,
Because those trusses have to be, it's not just a, go to the lumberyard and I need a truss for it.
go to Menards, just get the truss.
If they're having a sale right now, they're-
Store sale.
That building is 80 feet wide,
I think it's 72 feet by 130.
okay,
72.2, I think.
so that's
You
a,
didn't give us
that's a
any
border
dimensions,
truss.
did he?
Yeah.
Yeah, it's those are definitely special trusses that were manufactured.
Are you gonna need anything from St. Joseph County as far as this process goes?
I don't think so. I think our lease is pretty clear. You guys expect us to maintain the building, so we have the insurance and all that kind of stuff.
Okay.
If you're interested though in that and what we use for roof structure, be interested to hear what both of you have to say at least. So if we do that, it's gonna be an expenditure that you're gonna have to approve, right? Because that would be above and beyond the insurance coverage, and I'm sure,
Right,
yes, I'm sure it'll be more than $5,000.
oh, it will, but
So,
that upgrade will be more than $5,000,
Right.
yeah.
so that will come before you anyway.
Well, if there's anything from the county standpoint, we don't wanna be a bottleneck, so just make sure we work.
Service wise, we are up and going in Centerville. So if you go into the MDHHS building, they have a lobby, and then at the end of the lobby, there is I'm gonna say it's a 10 by 10 office with walls and a door that is separate from the rest of their office space. And that is what they're allowing us to use. So very kind of them. They're not asking us to pay or anything, just allowing us to use that office space. So our clerical is in there. And then 1 or 2 sanitarians with 3 people in there. It's real tight. But we're doing the best we can with what we have. We are accepting environmental health applications between 11 a.m. and 3 p.m. That clerk that we have there is our part-time clerk. And so her hours are 11 to 4. So every day we stop at 3 o'clock so that she has time to pull together all the payments that we've received. And she does a deposit every single day. That's not our normal business model, but it is what we're doing while we're in Centerville. It's because we don't have a safe there. We don't want, we want the deposit to go every day.
Was there any remodeling required to get into that
In
space?
Centerville, no. No, it had a space set up for desks and stuff. We just had to bring electronic equipment in, equipment in. We're using a hotspot because there's no good network there at all for us, so we're having to use a hotspot for like Wi-Fi. But so that's what we're doing there. We are still talking about the mobile unit. How to bring something back to Three Rivers. Teresa and I did look at an office space downtown Three Rivers this week. I don't think it's at all ideal. I think we're going to keep looking. If we are going to rent space, even for a short-term rent, I'm not sure this is a good fit. But we are looking because we do have staff that, are somewhat, I would just say homeless, right? They really don't, other than working out of their own home, or the expectation that they drive. And if we expect that, then we're losing 2 hours of their workday because we have to allocate them time to drive in addition to paying them the mileage to do that, to drive over here. So that's not ideal. So we're looking at all of our options at this point. I think if we lease space, there's some allowance from MMRMA to do that. And we'll keep looking and we'll keep you informed if we decide to go that route.
How many offices?
I think 10 to 12 people is what we need to find a space for. And then we would take EH out of Centerville and move it to
We'll be back.
So the bank is in a very similar situation. So I went office space hunting this week too.
Yeah.
There's actually it's too big for the bank, but there's one downtown behind Wendy's Southern, the old Norman and Paulson building. Have you seen that office space? It's too big for us, but there was probably, I think, 10 offices in there. The front desk. I think it was like $3,400 a month.
You'll have to tell me the address.
Yeah, I'll let you know. Yeah, but it could be ideal for.
Where was that at, Jared?
So the old Norman and Paulson, it's
Okay.
Behind Wendy, that strip mall.
Oh, in the strip mall.
North of Big B,
That's
North
true.
of Verizon.
Oh,
Yeah.
that's strip mall.
Yeah, right there. So,
Well, we went driving around, Teresa and I did too, and there's stuff out by IMED.
Yep.
By the sports complex in that end of Three Rivers, in that strip mall. There's a number of for rents there.
Yeah.
The place that we looked at downtown is the old newspaper building. It's pretty rough.
the Paulson News. Okay, all right.
Commercial.
Okay.
There's not a lot of traffic though downtown.
There's not really parking that would be an issue.
Yeah.
Client parking, I mean, where would they park? It's right next door to the post office.
Yeah.
So we already know the post office is a bit of a problem for parking, but.
Yeah.
So let's see. So I've talked about where we're doing business, talked about the building. I don't think I have anything else to report with regards to that. Nothing going on here in Coldwater. The contractor will begin the HVAC project on April 20th in Hillsdale. In Sturgis, of course, now that we are there 5 days a week, we've had to increase our cleaning. We were only cleaning that building once or twice a week. And now we've had to increase that schedule because we're there. So that's an increased cost, of course. And then again, more about the tornado. So I think that's what I have for you today. And do you have any questions?
Any other questions for Rebecca? Hearing none, thank you, Rebecca. Thank you to you and all the staff for the trying time that the last 2.5 weeks have been.
Well, you know what? I guess we should probably just publicly recognize the 8 individuals that were in the building at the time that the tornado hit. And they're all okay.
Thankfully, yeah.
That's right. Yep. It is traumatic to be near a tornado. I'm sure remarkably more traumatic to have lived through one.
Hope I never find out.
Me too.
I hope I never find out again.
Moving on, medical director's report. Dr. Lucarello.
Good morning.
Good morning.
I also think it's a testament to the emergency preparedness section that people knew where to go and to stay in the building, not to run outside. So as much as we all hate those drills, there's a lot to be said for being ready for those things. So tornado that came through Hillsdale a couple of years ago that like went right through the lake. I was out swimming in the pool. I didn't notice any change in the sky. I didn't notice any wind. And my husband came home and said, "What are you doing?" Yes. And I said, "Stop yelling." That's ridiculous. So, so that was kind of so anyway.
And my tornado public service announcement is if you have to take shelter for a tornado, take your car keys with you because you may not be able to enter the building again to get your purse, your credit card, your driver's license, or your car keys. Because I didn't let staff go back in once they were outside. And so nobody could get their keys or their wallets or anything because the building wasn't safe.
Yeah.
So, and they didn't carry it to the tornado shelter with them. So,
Good call.
just say, take it with you.
It's easy for me to
Take it
process.
with you.
It's in my pocket.
Cute. Well, my report has most of the same meetings that I usually attend every month. In addition to the Capital Day that we did on March 18th. And I know that over the past few years, we've been talking about Capital Day, and Chris and I were chatting, and we thought that maybe my educational piece today should be going over exactly what Capital Day usually is. So several of us go this year. It was just Chris and I because Rebecca was very busy with the tornado. And it is all our schedule's all prearranged. Chris does a lot of work to get us appointments with all of the representatives and senators. And there's a meeting in the morning where Melf, who is kind of responsible for Capital Day, the Michigan Association for Local Public Health, arranges some talking points for us. So at breakfast, you hear about the talking points. You get the little handout that's in your packet about this year there were three budget priorities and 2 policy priorities. So everyone who attends for public health is talking about the same things, and you might talk about a few things that apply to your counties as well. So we met with Representative Wirtz, Representative Cara, Senator Bellino, and Senator Lindsay throughout the day. And we also had, there is at lunchtime a Hometown Health Heroes Award. So everybody gets to nominate someone, and then there are 10 chosen. And we had Cameron Bluck with us, the CEO of Pivotal for mental health services. And one of his claim to fame, I think, is that he kind of founded almost an emergency room for mental health services. So, and he's got a lot going on, and he's expanding greatly. So we were happy to have one of our own nominations as one of the chosen health heroes. So the budget priorities this year, Rebecca just went over some of the essential local public health services. And in 2023, there was 73 million allocated for all of our health departments to work in essential public health. But obviously inflation since 23, et cetera, has caused lots of issues. So we were asking for some more money for local public health services. And they were all pretty receptive to that. I thought, Chris, feel free to chime in if you thought otherwise. And then we talked about children's special health care services, which is a very important, it's run by the Michigan Department of Human Services, Health and Human Services, and it works with families, so the patients anywhere from birth to 26, and if your child has some chronic health conditions, diabetes is included, but there's a list of 2,700 disease processes, and we help you with everything. Sometimes when patients come in with children's special health, I have to sign that they got transportation and how many miles it was from home to my office. sometimes they'll get a driver for you if no one can drive you. They'll help you with extra things like your insulin pump, monitors for blood pressure at home. So, and it is a bit income based. They'll look at your income, but everybody kind of qualifies if you're on that list of 2,700, and you might have to pay a little more out of pocket, but it's a great service. And that has been underfunded as well. And you can imagine that we have more children and young adults on that. So the whole public health world is asking for a little more funding for that. And also the lead screening that we have talked about here many times. There were new state laws for lead screening, which led to an increase in lead screening and also an increase in children with lead exposure because we lowered the level of what was adequate for lead exposure. So we also help those people with all their resources, right? How to fix their house or how to get out of where they live or what their child needs to decrease their lead levels. And then if that led to a decrease in learning or some developmental delay, we help with all the resources for that as well. So ask for some extra funding for that. And then the two priority policies were very interesting to me. The first one was tobacco retail licensing and youth access to tobacco. This was really sponsored by Representative Wirtz. He was pretty powerful in bringing this to the forefront. And I had to do some more research because I kept saying, isn't that a complete no-brainer that like people who sell cigarettes should be regulated as to who they sell them to? But obviously it's not a no-brainer because there are 8 states that have no regulations and Michigan is one of them. So this was a bill to start to regulate places that sell tobacco with extra issues if we see that they start selling to people under 25. So, and it was tobacco products, so it included other things as well as cigarettes. And actually, right before we saw Representative Wirtz, there was a group in there advocating on the other side of this. So it was quite interesting, right? They were talking about the fact that wasn't a big issue, but clearly it is. And then the last one was updating Michigan's food law. So we are still living with food laws from 2009, and the FDA has done at least 3 revisions since then. So what we're working with is a little bit behind the FDA. And those are things that include like certification of food managers and the risks of foodborne illnesses and stuff. So we're not quite up to date with what the FDA supports. So we were advocating to kind of get a bill in there that gets us up to date. So sometimes you get to talk about these points. Sometimes you get a lot of time. Sometimes they're rushed and they have another meeting. Chris is amazing. She's a very good speaker about all of these points. And I think that it helps that they see a familiar face also. So they know Chris, they know where she's from, and that kind of helps us. And then sometimes we get their agenda a little bit. So we did get a little bit of that, here's what I think about blah, blah, blah. And some of it was, not quite back to this. So we kept trying to go back to this. And I thought it was kind of interesting. We followed some Michigan potato farmer groups, and we followed a succulent group that had all their stuff still out on the table when we came in with plants in a box. And they were trying to give them as gifts, which I thought was kind of odd too, but because they were, a couple of them, especially Senator Lindsay, said, no, I don't really accept gifts. And I said, well, are you allowed to accept gifts? And he said, yes, that they were allowed to accept gifts. So I thought that seemed like a conflict of interest too, but it was just a little succulent plant. So, but they're always a great day. I really like going. You meet some new people. They're a lot of them are very interested in the day-to-day and they don't understand some of these things. So once you start explaining, then all of a sudden this light bulb goes off. Like, oh my gosh, you've been working with the same amount of money you've been working with 3 years ago when things have completely changed and your caseload has changed, So it's a very valuable day. So I'm glad that I'm able to go and that we send other people from our counties as well. And I think that was all I had about see the Capitol.
Thanks for representing us.
Thank you. I answered it.
Any questions for Dr. Lucarello?
not necessarily a question, but I do have a comment. I appreciate you guys going to the Capitol and doing that. I've commented on this in the past. The Children's Special Healthcare Services, I'm a big fan of. It's too bad that it is underfunded right now. Well, I was diagnosed with diabetes when I was a freshman in high school, and I grew up with a single mom. We did not have hardly any money. And having it back then, it was called the Crippled Children Fund, which I'm glad that we upgraded to the Crippled Children's Fund. So, but growing up and diabetes was very expensive back then. It's become a little bit better now, but it helped our family out big time. And then obviously when my son Lincoln was diagnosed with leukemia at 5, same thing. You know, you're as a parent, you get told this news, and the finance part on the back end. There's a lot of stresses that go along with that. The finance part being like, okay, hey, we got your back. We'll help you. It is a huge relief from a parent standpoint. I mean, it's so this is very, very, very important.
I agree. I think it's one of the best programs out there.
It is.
I mean, and I see a lot of like Down syndrome adults, you know, so there's a 30-year-old Down syndrome patient, their parents are, you know, 70, 80, you know, and I, you know, sign their little form, like they wouldn't get there. They wouldn't get to their appointments. They wouldn't get equipment that they need. And yeah, these families, once you see chronic conditions with a kid, you really need that extra hand.
Hopefully they were responsive to that.
They seemed to be pretty responsive to that, I thought.
Good.
They didn't, a lot of them interestingly didn't know what it was.
Yeah.
So had never heard of it, or, you know, didn't
Get the
even
word
know
out
it
is important.
exists. Yeah.
Absolutely.
Yeah, and we did get the question, you know, is it only for certain people in certain financial groups? So we made sure to address that. No, it really is not.
We paid, you know, and we're middle class. We paid, and but it's a, you know, one of Lincoln's treatments, one of his chemotherapy treatments was when the nurse brought it in. I, you know, out of curiosity, said, "How much is that?" She said, $14,000. So again, because we had this and we had insurance, obviously as well, but it's just, you know, you're thinking of a million other things besides the finance part, and to have the Children's Special Healthcare be a part of that is a huge relief. So,
What's a lifeline helicopter, right?
yeah, right. Yeah, I don't know.
I've seen them twice.
Yeah, that's true. That's true. You've been on the end of that too.
Interesting. I don't remember if it was that day or someday after that, they had a House committee meeting on the tobacco, and what it is it's requiring all retailers that sell tobacco licenses or tobacco products would have to obtain a license through the state. Some of the interesting data that was presented in that is less than 20% of youth who are surveyed say that they get their tobacco product from a store. So we say we need to license these retail establishments, but that's not truly where they're obtaining, the vast majority of youth are obtaining that product from.
It's like liquor, the other, if they want it.
It's still family or right, yes, they're not directly obtaining it. So
They do give us an opportunity to talk about vaping a little bit as well. So that's pretty popular in the young community as well.
okay, thank you, Doctor.
Thank you.
Moving on to department reports. Health education and promotion.
Good morning.
Good morning, Ms. Dewey.
So, yesterday we sent out our press release announcing the launch of the Lock It Up campaign. We have 28 locations that are assisting us in the distribution of our safe storage devices. This year we are including our educational videos for social media. We'll be doing radio ads and also doing some advertising through streaming services just to share that Lock It Up message. Our 26-27 Office of Highway Safety Planning Grant has been submitted to the state. We could find out in midsummer what our award will look like for that work. We are continuing to plan for our presentation for the Michigan Drivers Education Teachers Association annual meeting presentation in Grand Rapids in April. Very excited about that opportunity. AJ was out with a couple of the civic groups this month as well, and we have a couple additional civic groups to present to coming shortly. Starting, I believe it's gonna start April 1st. If you go to the Secretary of State's offices in one of our 3 counties, you will see a slide presentation, closed caption presentation of the material for the grant as well. So we go to the Secretary of State, sit there long enough to see our turn. I'm told it'll go off 4 times every 15 minutes or something. We've also been busy working on the Hillsdale County opioid asset mapping project. And the annual all-staff meeting coming up on April 24th. That will be our all-day event. That agenda has been set. So we're working on our logistics at this time, and we are very excited to see all of the staff get to come together for that day. In regards to the community health worker program, our full-time community health worker is currently on a medical leave. So our part-time staff person continues to work. She's at Covered Bridge all 3 days now. 2 days as Covered Bridge support staff, and the 3rd day she's working as agency staff. I want to acknowledge and thank Covered Bridge for allowing us to have space for her to have a place to work, because normally she works out of Three Rivers office, and that's not available to us right now. So
She's another homeless staff member.
so Covered Bridge has taken in my little homeless person. And I greatly appreciate their willingness to do that. And I think that is highlights of my report for you.
Any questions for Chris?
I just have a comment.
Yes.
I attended the programming at the CYC Center in Centerville relative to the traffic safety grant. It was very well attended. It was dovetailed with a couple of other safety type topic discussions. I understood about 10% since it was in German. So, but lots of good handouts, and people said it was great programming, and it was long. So I was glad to attend, but it was a little painful on the backside, quite honestly. Wooden benches.
Yes.
Wooden benches that they convert into tables later on.
Yeah.
We were very honored to have the opportunity to attend that event, and as you said, it was a late night for the staff member, but I think that the messaging was very well received, and we had an opportunity, AJ had an opportunity to talk to several individuals, some of whom are not from this area, who are from other areas of the state and actually other states. So it was a good opportunity for us to get some more messaging out.
Yep. And buggies are being greater well lit. I've noticed, so they're taking advantage of the education.
Okay, yes.
I think, Chris, have you thought of maybe in like the corner of our counties, like Litchfield, Waldron, of putting the lock it up bags in them areas? Because I know, I don't know, I would imagine Litchfield goes to like Concord to get where that thing is, where, I mean,
So at this point, we work with a set of partners. If there is a partner in Litchfield or Waldron who would like to partner with us, distribute bags, we are happy to do that. I'm not sure who those partners would be.
I would get a
but-
hold of the city manager and I'll have her call you
Yeah, if
and
there
see
are-
if she wants to do it.
Yeah, if there are individuals or groups who are interested right now. You know, we work with the sheriff's departments, we work with DHS, community, the Lifeways, Pivotal, the Pines. We have dispensaries / retail services in all 3 counties now. So we have the opportunity to get things into the hands and folks at point of sale, which I feel is really a good opportunity at point of sale to say, here's this. And actually, when I went to deliver to the 3 locations in Hillsdale County, they were like, oh, people have been asking for these. I'm so glad you're here. So I think,
And I'm just wondering about these corner cities that,
we're absolutely.
you know, you can go across where it's
Sure.
closer for them to go to someplace where they work, Jackson County or Calhoun County.
And other health departments have the same funding that we have, and they may also be doing the same type of programming, so I can't say that. I'm not sure what Calhoun's program looks like, but they could still be getting something in Calhoun County. But if there are individuals or groups that are interested in helping us to distribute, absolutely, we're open to talking to them and making sure that it makes sense.
Okay, thank you.
Okay. No other questions? We'll move on. Environmental health,
Morning.
Mr. Joe.
Good morning. Well, it's been busy. I want to start off by saying I appreciate everybody in the agency rolling with all the punches that we've had. It's not just EH that was displaced, at all of St. Joe County. So I want to thank my staff for being patient and dealing with new stuff every day. We really don't know. So that has been our mantra. Stay a day at a time. So as Becky mentioned, we did go through accreditation. We're the second in the state, which is, I think, is great. The food program, we have been talking with them pretty extensively. They've looked at our stuff a few times before accreditation had started. They came down and very complimentary of our staff in conjunction with not only looking at our paperwork, we have to send 2 of our staff out with state of Michigan inspectors. So they're being graded by the FDA standard that everybody's graded on, and our 2 inspectors scored over 90%, which that's pretty awesome. You know, that I'm proud of them. So they did a great job that way. We've also went through accreditation for the on-site program. I'm very proud of our staff there too. There's been a ton of things that have changed. A lot of new staff. It's been a challenge, but Kyle and the group have done a tremendous job there. And we've already implemented a lot of these changes and we're moving forward with it. So our program is going to be really rock solid. We intend to do evaluations once a year just to see where we're at so that in the next 3 years, when this happens again, cake really will be. I want to take a moment to introduce Olivia Kamarick. Am I saying that right? Paramedic. Dang it. I practiced like Olivia is our new staff person that is going to be working in the Type 2 non-community water program. She's going to be based out of Coldwater. Her first day was the day after all the tornadoes. So it's been a whirlwind for Olivia. She's doing a great job, just rolling with the punches and getting out there and getting training. And I'm excited for what she's going to bring to our agency. Also, Kyle Moore, who is our general supervisor. I also want to thank Lee. Man, that's a long time to do it. I remember as a new sanitarian, I got to Lee was messed up with his elbow, and I had messed up my eyes with contacts, and the EH director at the time sent us out into the field to do stuff because we could help each other. You know, it was just so you think of those fun memories. But Lee has done a tremendous amount of good work for our public in all 3 counties. And the knowledge that is leaving on that day is going to be tough. That's a lot of experience. So we're up to the challenge. We'll be able to get it done. But I just want to thank Lee for all his hard work. So, and Commissioner Leininger, last time we were here, you wanted an update on time frame for inspections. The tornado kind of threw a curveball at us. We will have that at the next meeting. I promise you that will happen. Town and I are working on that. So I just wanted to update you on that. I didn't want you to think I forgot it or jerked it. That's important. I want to give that to you. Other than that, that's all I have unless you all have some questions.
I forget. You guys deal with ticks in Vernon Hall?
We do. Yeah, we have a Vector program as part of our,
When are we starting? When do you start looking?
it will be end of April, beginning of May.
When do we start messaging for people to be watching for tips?
Mhm. No.
Because they're out.
You know what?
Hard.
Hard. Crazy.
They're out hard.
Yeah.
They are.
Not
They
looking
are.
forward to it.
I may be found on yourself.
On myself, none.
On your animals, how many?
None. I found one on my son.
Okay.
I picked one off one of my cats.
I treated a little kid last week. Well,
Oh, yeah. That's
See, it's-
mine.
yeah,
Oh, my.
a little brown.
I'm hoping that there's been a little bit of increase to funding to the Vector program, so I'm hoping that equates to more testing. You know, we'll be able to send those up there if we find the ticks that are responsible for that. But they've got a big kickoff meeting coming up, so we're ramping up. We're getting
The other thing I had a question from our local fire department who routinely will have a pancake breakfast at the fire hall. Wanting to know if there's any way that, I mean, they do it more than once a year.
okay.
And wanted to know if there's any way that, you know, they wouldn't have to pay the $75 every time they do that.
Absolutely, it's called a limited nonprofit license. Absolutely. Yep, that allows them 60 events in a year.
And the cost on that is,
I think it's 170. I'll have to look. I can get that to you.
I think it's more than, is it 3 that makes it worthwhile for them to?
3 makes it worthwhile. Anything less than that, you might as well just pull temporaries.
okay.
Second here out.
So they still have to have, a certain infrastructure.
Which that may be the issue because they just click on,
See, that's
yeah, they just click on portable flat tops and flagstones or.
Yeah.
so the kicker in all this is if you're going to get a fixed license like that, temporaries don't require a certified manager, which Dr. Luke Bro is talking about in the new food code that will hopefully be proposed. Currently, if you go to that limited nonprofit license, you have to have at least one person that's gone and taken ServSafe or equivalent certified food manager, and that can be tough for people to go and get that testing, right? And sit for the exam. But we're lucky that it's held once a month here.
Well, I think we would be because our fire department chief's wife is the head food and nutrition at Wolverine Area School, so
Well, you would think she's had.
I'm pretty sure she's had it. So
Limited nonprofit, I'm sorry, I misspoke, it's 140. And that's 2 inspections here. The other thing I'd want to look at is their well, make sure,
Their village water.
village, municipal, okay. I always panic about that, always ask. But yeah, no, 140, we can get them licensed up. That's easy peasy. I can have staff reach out to them and start that conversation.
Okay. Because the pancake breakfast they had last weekend, they actually moved to the school, so they wouldn't to save on that.
Save on the money.
Litchfield does something, they get a license, it's good for a year, I think.
Maybe
They don't have to,
it may be
but
that
they don't
limited
have to, be
nonprofit.
only inspected the one time.
Yeah, the limited nonprofits. Yeah, limited nonprofits twice a year. That's how we do that, and they just have to notify us the day of their events. So that way, if we need to get out there and do an inspection, we can get them while they're actually serving.
What if their events are just seasonal?
If they're just seasonal,
Then you could do one of
we
these.
can do one. Yep, we can do
Well,
a reduced frequency.
That's might be what they do is seasonal, because we do one for sweet corn days and then one for Christmas.
So it might be a seasonal limited nonprofit.
We have done that, yep. I'd have to pull up.
Cause I know we only got inspected one time.
Well, we're either
And that was
negligent.
back, that was back 5 years ago.
I'm just
So
saying you're doing it seasonal. It's definitely seasonal then. We're not negligent.
All right.
So.
Answers my question. Moving on. Anything else for environmental health, Mr. Joe? Hearing none. Ms. Laura.
Hello, good morning.
Very good.
Morning.
Well, it's been a very busy season of contract assessments, the accreditation process, financial and all sorts of audit. That doesn't leave area agency on aging without a seasonal assessment or monitoring visit. So we, in mid-March, March 19th specifically, went the contract review, which is an every 2-year process for our Division of Victim Services grant, our victim assistance program, and had a great visit. There was a lot of preparation and a lot of uploading and multiple agency departments involved in our response to their questions. And they did end up commending us greatly a number of times throughout the different sections of the review that day on the great amount of work that they could see and use to track back what they needed to track, and recognized our team's hard work. So Teresa's division, our division, was primarily between personnel and finance and HR, and then Teresa's policy perspective. So, and then our team did a great job. They, even though we had a lower level, sort of lower risk monitoring visit, they still looked at a random selection of cases. We had, as you know, last year, a record number of individuals that we worked with. So our staff didn't know who they were going to pick and asked a bunch of detailed questions, and they did a phenomenal job responding. So I'm going to echo our agency's leadership team and that we have a fantastic team, and others are recognizing. So that feels really good. The other thing that they recognized, which I'm particularly proud about because I've my entire career have wanted to work very hard to make sure our community partnerships were strong, and they noted that throughout, again, you know, your volume of referrals and the way that you conduct your meetings are conducive to strong community partnerships, and so that felt really good as well. You know, they even noted the post-tornado response because our team was on the phone first thing Monday morning with the affected communities to try to make sure the people that we were serving or their emergency contacts or both were reached and assured that there weren't any supports or services needed. So they did note a couple of minor tweaks to forms in some of our policies just because of a federal rule change or a best practice that has sort of come to light over the last couple of years. So we'll be looking at that and definitely we'll get those, you know, amended to throughout the, you know, our response and can address those. One, we had to note a veteran-owned business was one of the, in the procurement policy, for example, that Teresa worked so diligently to put together. We need to designate that, you know, veteran-owned businesses will be welcomed to bid on anything. So those types of minor tweaks we'll take, and the report itself back to the division is expected within 6 weeks, and then we'll get to work on those suggestions. But there were no findings, so feel really good about that. We continue to work on the details for that Elder Justice Symposium. Again, we're looking at the training center in Centerville for September 17th. We still haven't received our full year notice of award at the state level. We're hoping it's very soon. Like they keep saying very soon, very soon. So maybe this week. We just don't know. Once we've received that, then we can work on issuing and entertaining any contract amendments with our providers. So we again are anticipating continuation level of staffing update. As Rebecca mentioned, we got a start date for an outreach specialist, so that person will be trained in multiple different program areas, including the My Options program as an options counselor, and the SHIP, the State Health Insurance Program. So we're very anxious for her to start. My Options update, we remain busy with calls, walk-ins, and referrals, and We were awarded that senior Medicare patrol grant, so we had to do a minor budget tweak because they couldn't award us the full amount that we asked for. Wasn't a surprise. So we made some quick tweaks, and Rebecca's gonna be, or maybe already has signed that contract this came through. They'll be gearing up and have done a couple of webinars so far, so just to prevent fraud, waste, abuse in Medicare. So that'll be a good addition to our health insurance counseling that we do across the region. And we'll share all that information out with our sites that do Medicare counseling, so it'll be a collaborative effort. Just a few notes in our storm recovery and support from the area agency division. Again, our victim specialists and then our nurse social worker, Shelley and Denham, worked diligently to connect with all of our partners and direct clients that we work with in all the affected communities. We've definitely received an influx in referrals and questions about local supports and services. And we've had staff present at both of the multi-agency resource centers that were established in conjunction with local officials, both in Union City and Three Rivers, and had great dialogues with individuals. We took sort of, for the victim assistance program, for example, we took a one-page flyer on scams that are, for storm recovery scams that happen. Contractors come in and say they'll do X, Y, and Z and pay us 20 grand up front and we'll get you this. And then they just walk away with your money. So those types of fraud prevention and scam awareness material was shared. And it really is, disaster has brought us together. So I, reconnected and reaffirmed, some community partnerships in the Union City Senior Center, for example. I'd never physically met that individual face to face, so I had a great opportunity. And then we followed it up and were invited right away once they settled on their date for their resource event. So it was great to sit with Joe. Our staff sat right with Joe and Health Ed to be able to reach out and give people information to help them for generator safety, all sorts of neat information. So it was a really it's humbling, and your heart just bleeds, and we know requests and issues will come in months to come too. So at least now they know where they can call to get a little bit more support. The Direct Care Worker Help Program originally came through in early December, if you'll recall. That mini grant, that original mini grant, which was privately funded through our association, ends March 31st. But there is hopefully another round of funding that we're going to hear about that will be implemented the same way, and it'll just be another small mini grant to be able to support direct care workers who are employed at our Commission on Aging offices in both counties, as well as with our home care agencies. So I would say Branch County Commission on Aging has led the direct care worker help with a lot of vehicle repairs. And as you can imagine, with aides out in the field when that tornado occurred, for example, they may have gotten a few nails in their tires on their way back from, trying to just get home safely after the threat was gone. So those are the types of emergent needs that are funded with that funding. So it's gone well. We'll hope to do more of that through the summer if the other private source comes through. I did want to have you mark your calendar for May 13th. That is Older Michiganians Day, and the platform and other social media posts and things and the printed material and flyers are coming out very soon. We'll be sharing that, but I did want to get that date on your radar in case you want to go to Lansing with us. It's a great advocacy event, and definitely want to promote an increased home and community-based services, as well as a couple of other things, including caregiver and direct care workers support. So we did get a letter that and if anyone would like a copy of it, I'm more than happy to share it, but it just came this week, so it couldn't go out in the packet last week. Every 3 years, the Bureau has us submit our contract templates that we use with when we initiate and when we enter into an agreement with providers and purchase of service vendors. They've conducted that review and have acknowledged that our contract boilerplate that was submitted, was evaluated and it adheres to the operating standards. So we are good to go as we move forward this summer with our 2026 request for proposal, which coincides with our planning, 3-year contract and planning cycle. So that will be gearing up very soon. I've already started working on our timeline for when we'll start our community needs assessment. I meet with Chris next week about that. It's just all this stuff, you know, once you get through a few things, then another couple of things bubble up and it's just a flurry of work, but it's all good. And we'll be setting public input forum dates and locations. I'm strongly considering and want to perhaps host one in the city as a result of that new community partnership. So that would be fun to go there. But we gather and take a look at data and demographics. We have the tables that the Bureau gives us, but we always do a little bit deeper dive with all that because they have great expertise in the demographic area and looking at the ratio of older adults, the percentage of low income, minorities, and all the different demographics that we need to take into consideration as we plan for services. There's also a couple new operating standards that we'll be considering, you know, using rather than perhaps a regional service definition. So that'll be good as we move forward as well. So stay tuned on that planning and contract cycle time. And again, just let me know if you really want to have a copy of the letter that the Bureau sent us about our contract with.
I already have.
It did go to Commissioner Leininger as the chair, but if anybody else would like that.
Notice I held off on saying that I had that until you could have.
Any questions?
Thank you, ma'am.
Thank you.
Thanks. Miss Heidi, personal health and disease prevention.
Just a couple updates. Respiratory illness activity in Michigan is declining, but still elevated. We're currently on the low end of high activity. This means people are still seeking care for flu-like symptoms. Back low for COVID and flu. Nationally, there have been 101 pediatric deaths this season, 3 in Michigan, and 85% were unvaccinated. Flu vaccine effectiveness this season is moderate, which is helping reduce outpatient visits and hospitalizations, especially in children. RSV season kind of started late, so we do anticipate seeing some activity continue into April. COVID-19 cases are declining, which is encouraging, and measles continues to be a growing concern. One last number I have is 1,487 cases reported in 2026 so far. In Washtenaw County, just announced yesterday, they have now have 7 confirmed cases, and all of them are vaccinated.
And I think I heard that there's a potential exposure from the ER room on Saturday.
Evidently, that's one big happy family.
It's not
Like
the same
10
family.
kids and then, you know, other relatives, but it was in my meeting this morning too, that some of them attend Community College, so they were looking at like a class of 50 that was leaving and a class of 50 that was coming in, and yeah, so all unvaccinated, so another hurrah for getting your vaccine.
And we have been preparing for things here for if and when. Some good news though, our jurisdiction is performing very well in adolescent meningococcal vaccination coverage. All 3 counties rank in the top 15 statewide. So that's pretty exciting to hear. We still have a lot of work to do on our coverage for the primary childhood vaccine series, but we'll just continue our efforts there. School immunization reporting was due on February 1st. 100% of our districts met the 95% or higher reporting requirement, which is important for funding. And we are preparing to launch MyWay, which is a new online education tool for parents that are wishing to seek waivers. They'll be able to do the training at home, online, and they can't fast forward through the training. They have to watch every video, answer the questions, and then at the end, they still have to make an appointment with us, but either hopefully get the vaccine or sign the waiver. That will just kind of help make sure everybody's getting the same education across the board. And then I did hear of news that we are going to be having to change the waiver language to exemption. So let's change. We were part 22 local health departments that provided input into this development, and right now there's about 36 health departments that are using it. As far as WIC update, we did make some adjustments for the tornado situation. We've shifted some appointments to a virtual format, replaced some formula to families who had lost their supplies. And then the WIC's management evaluation is scheduled for the second week in April. The majority of that will be here in Coldwater. We have one day in Hillsdale. So our WIC coordinator has been preparing for that. They're ready for it. And then kindergarten roundups are scheduled again and started. We'll be providing hearing, vision, immunizations, and the dental screening supplies as well. And then just to finish up, I also want to give a kudos out to my staff. We had 6 programs that they all worked really hard on.
That's it.
Any questions for Heidi? Thank you, ma'am.
Thank you, Ed.
Moving on. Item 7, financial reports, approval of payment, 7A.
And so, good morning. I'm gonna start off by highlighting a little bit of difference. Because we've been talking about accreditation so much, this staff worked really hard on that. And it is, I guess, sometimes harder for me to think about accreditation because audit happens every year and we get feedback every year. Where accreditation, we get feedback every 3 years. So it can be a bit more stressful. And with, accounting and audit, you either did it right or you did it wrong. There's not this big gray area or different ways things can be interpreted. So kudos to the team on their accreditation. It is a totally different animal and it is sometimes harder to deal with. And because you're not getting that constant feedback, you're only getting every 3-year feedback.
And yeah, there's not a, well, you did it wrong. Design a plan, fix it, and then send us a plan and we'll update our report afterwards, not with audit, no.
Right. So, and like Chris and I worked really hard in this past accreditation cycle on quality improvement, performance management, and we thought we were doing great. And you get into the meeting and they're like, oh, but if, you're doing really good. But if you did this, 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 and you walk out of the meeting going, gosh, I felt like we were doing so good. We've come so far. And, they did acknowledge that we've come a long ways and that we're doing great. But, we want you to do better. Where accounting, it's either right or it's wrong. You did it right or you didn't. And it's just a different experience. So I wanted to acknowledge that. So, you do have the bills before you. I would point out a couple of different things here on page 89. Fisher Healthcare, no affiliation with me, mind you. That was for some emergency preparedness equipment that we got a special grant for. So that was equipment that we were able to purchase because we got that special grant to cover it. And then on page 91, you'll see the unemployment. It says unemployment insurance, which is really not coded correctly. It's unemployment payment. We do not pay for unemployment insurance. We pay the total of everything they pay out, and we pay that annually in February. So that's why that's such a big number there. It's only paid once annually. I would be happy to answer any other questions you have.
Any other questions, or do I have a motion to approve the payment as presented?
So
Support. I have a motion from Commissioner Huff, after support from Commissioner Schaefer to approve the payments as presented. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. Next is the month-end financial reports for February 28, 2026.
Yeah, so you have the balance sheet before you and your report. You'll see that we are 3%, a little over 3% under budget currently. And we are watching a number of different programs for budget amendment. Be happy to answer any questions.
We've already done one budget amendment.
Yes. We'll do the other one in either May or June.
Any questions regarding the financial statement?
Motion to approve as presented.
Report. Have a motion from Commissioner Schaefer, support from Commissioner Collins to approve the financial statement as presented. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. Next is committee reports, Finance Committee, meeting minutes from March 16th, 2026. Mr. Hoffmaster, if you want.
Yeah, so you have the minutes before you. We discussed many of the things that are on new business. Got an update for from Rebecca on the tornado. But yeah, I'll have any questions. If I don't have any questions, I will make a motion. We approve the finance committee minutes as presented.
Support. I have a motion from Commissioner Hoffman, support from Commissioner Collins to approve the finance committee meeting minutes as presented. Any discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. Program Policy and Appeals Committee, Commissioner Schaefer.
Your packet have as presented the March 18th meeting that was held. Many issues we've already discussed, but we did spend a considerable amount of time on the MMRA insurance policy, but didn't take any action yet. Also discussed employee recognitions, mentioned this morning. And that pretty much concludes my report.
I'll entertain a motion to approve the Program Policy and Appeals Committee meeting minutes as presented.
So motion. I'll support that motion.
A motion from Commissioner Collins, support from Commissioner Hoffmaster. Any further discussion? Here.
One.
Huh?
I better get in on one vote.
There you go.
Hearing no other discussion, all those in favor say aye.
Aye.
All those opposed, motion carried. Next, there is no unfinished business. That brings us, we have underneath new business, Three Rivers Building post tornado update. I think we've kind of, for the most part, gone over that already. Item B, website redevelopment. From page 98.
Commissioner Hawkins, or you want to say anything, or
We went through this in the finance committee. It feels like there was a fairly significant difference between the two bids that we had. Staff felt like the recommendation should be the Inspiration Studio Designs. We went through it.
Yes, and so it was scored internally. The scoring sheets are on, begin on page 98. Based on the review that we did, Chris and I took a look at these and did the scoring. Based on that scoring, the staff is recommending Inspiration Studios be the bid that's awarded by the Board of Health.
Where are they at?
Alabama.
Well, they have a Michigan office.
I just had seen the one page there. I think the fourth page showed Alabama.
Yeah, but they have a Michigan office in Hastings. Page 117. Those are Hastings.
Well, I am happy to see this one document here, but they do have technology professional liability.
This particular company has designed other local and public health websites in Michigan. So we wouldn't be their first stab at it with regards to local public health. And we feel confident based on the information they submitted and conversations that staff have had with them that they will provide a great product for us.
We also noticed in the bid that it looked like Second Story was almost contracting it out to another provider. That might be the difference between the costs where Inspiration Studio Designs is going to do it. So I'll make a motion that we approve the website redevelopment and approve the bid from Inspiration Studio Designs.
From Hastings, I'll support.
We have a motion and support to approve the bid for website redesign with Inspiration Studio. Any discussion? Hearing none, all those in favor say, because of the dollar amount over 16.
It was 13.5.
13.5. All those in favor say aye.
Aye.
Aye. All those opposed, motion carried. Next is the annual report, and that is starts on, I believe on page 130 of our packet.
Yeah, so Chris makes this happen. She gathers information from all of us and puts it together. And it is here for your review today. We will take this out on the road. I will be visiting all of your commission meetings to share this out with your commissions. We share it with our human service organization and other local health departments in Michigan and anybody that wants to get it. So we always post it on our website. If you go to our website, you'll see many years of annual reports there that you can peruse.
And the program policy committee did review this and did recommend adoption by the full board.
When you do go on the road, St. Joseph County is now meeting at the road commission. So we'll have you because of the renovations to the courthouse. So
Okay.
District Court is going to be in our chambers and they're kicking us out. So coordinate with Teresa, obviously, but we'd love to see it.
Okay, on the river.
Yep.
Almost.
Yeah.
I will entertain a motion to approve the annual report as presented.
So moved.
The board.
A motion from Commissioner Hoffman, support from Commissioner Collins to approve the annual report. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Item D, underneath new business is employee recognition, and we have many employees who are celebrating or did celebrate last year, employee service anniversaries with the agency. We want to thank them for their long-term tenured service with the agency. Commissioner Schaefer and I did sign certificates and a letter for them at the Program Policy and Appeals Committee meeting, and I'll try to make sure to get over to the all-staff meeting day for that recognition also made. So Lisa Redmond, Chris Ash, Cody Johnson, Jolene Sheffer, and Melissa Gilbert. So,
We're glad to have every single one of them. So
no action needed on that item. Brings us back to item 11, public comment. Do we have any public comment? Hearing none. Commissioner comment.
Mr. Chair?
Yes.
Love to recognize the individuals with longevity. They're an important part of the organization, and also a big part of the organization too is the employees that have made the flexibility possible as far as going through our storm and our tornado in St. Joseph County. We appreciate the flexibility. We appreciate the staff. The organization is doing a phenomenal job. We ask still patience. I know, again, we're kind of going through the same thing at the bank, and it's not easy and it's not fun, but as a community, we come together and support one another. And as a board, I think I can speak for all of us to say that we'll support you and what you guys need to. So, but super proud of the organization. So,
Yeah.
I think it'd be important just to have reflected in the minutes that we appreciate Lee Zimmerman's service to the agency. So it's been a super friend to, I know, St. Joseph County very well there. And I'm sure is in the other counties as well. But he's put in tremendous dedication for the agency. I just think it'd be important to recognize him in minutes.
thank you for that.
Couple things. So on our desk today, we're also flyers on the septic replacement loan program that's available through State of Michigan and Eagle.
Yes.
And then the household water well program. RLF, I'm taking something rural loan fund.
Yes, yep, there's an opportunity for extremely low interest loans for folks that are having a hard time replacing wells or septics. And it's always there, but in the case of the storm, you know, when people maybe having to replace systems or having damaged systems, those are opportunities I just wanted to pass along that maybe the public can take part.
Which I guess brings me to our comment, and I know we'd had some conversations, Rebecca, you and I, about this a little bit, and with some of the extensive damage to some of the homes up in the Union City area regarding their maybe even potential for rebuilding those homes, and those homes not meeting current environmental code because of their septic system that was in place. Most individuals, if they had health insurance or house insurance, most individuals with house insurance will provide additional coverage to upgrade certain systems, bring it up to current code if it doesn't meet current code for replacement. But that insurance doesn't pay for you to put in an entire new septic or a public sewer system for a lake because it, you know, it's limited to that parcel, that prop. So not sure where we're standing on some of those issues up there yet. But yeah, I know that that's of a concern. And so.
Yeah, we're trying to plan ahead, looking at a lot of different scenarios.
We don't have any applications yet, right?
I think we have received one. Just this morning, maybe.
Okay. So something that we may be inundated with requests for some variances or something in the near future.
There are a number of individuals out there that did lack homeowners insurance.
It looked to me like there was also a large number of mobile homes in that area. And those they look like maybe older mobile homes, and you're looking at probably maybe one major carrier for a lot of those. Their policy doesn't necessarily provide as much coverage for those ordinance and law things that a traditional homeowner's policy would. So, all right, hearing no additional business, I'll entertain a motion to adjourn.
So moved. Support.
And motion from Commissioner Hoffmeister, support from Commissioner Towns to adjourn. All those in favor say aye.
Aye.
All those opposed, motion carried. We're adjourned.